There are many mental health conditions that can come up during pregnancy and postpartum. Perinatal depression is only one of them. Women can also experience perinatal anxiety, OCD, PTSD, and even postpartum psychosis. There are several known risk factors for mood disorders during pregnancy. These include it being your first pregnancy, you having a personal history of mood or anxiety disorders, having a history of childhood trauma or sexual trauma, and having mood shifts in response to hormonal fluctuations in your history. There are also some environmental risk factors for mood and anxiety disorders during pregnancy and postpartum, like fertility challenges, financial stressors, and lack of social support. Reports suggest that between 1 in 4 and 1 in 5 women experience symptoms that rise to the level of an anxiety disorder or depressive disorder when they're pregnant or postpartum. However, we also know that many women don't report their symptoms because of stigma or because of fear of what might happen if they do so. So we think that those numbers might actually be a lot higher. So there are multiple signs and symptoms of the different types of mental health conditions during pregnancy and postpartum that we would want to look out for. If I were worried about postpartum depression, I would be looking for things like if mom is not sleeping, even when she can sleep, because she's got so many worries, or she's just feeling so sad. I would be looking for excessive crying that's going on past the 3 to 5 days that we usually think of as baby blues. And I would be looking for potential thoughts of wanting to hurt herself. If I were worried about postpartum anxiety or OCD, I would be looking for mom avoiding doing things with the baby because she's nervous that she's doing them wrong, or having a lot of thoughts about what she's done with the baby and worrying that she did something incorrectly. If I were looking for postpartum PTSD, I would be looking for avoidance of where baby was born, because that might mean there's some trauma-related reactions to the childbirth, or nightmares or some jumpiness. And if I was worried about postpartum psychosis, I would be looking for some scary thoughts that mom is having about people thinking certain things about her, or even hearing voices that other people didn't hear. Many people don't know that untreated psychiatric issues during pregnancy can lead to negative outcomes during childbirth and postpartum. Women who have untreated depression and anxiety are more likely to have emergency C-sections, preeclampsia, and babies with low birth weight. They're also more likely to have postpartum mental health issues. And women with postpartum mental health issues are more likely to have a tough time connecting with their children, attaching with their children, and their children are more likely to have a tough time in school and have mental health issues of their own. Although it can be quite scary to seek help for mental health concerns during pregnancy, medications and therapy are very safe and very effective and can lead to better outcomes for you and your children.